this vaccine. And I call upon our people of this region. This is a committed fight. It must be a spirited fight. The MC said here that now that this vaccine is coming here, it is not an open door for us to move without respect, without being conscious of our lives and those of our friends, then moving around anyhow. We need to prevent the spread of HIV/AIDS in Lamu sub-region. I know Lira City is so metropolitan now. There are so many people in this small city, so many activities, and therefore it makes it very, very tricky for the people to see how best they can save themselves from the spread. But we need to do it as leaders. We have always been guided by the Honorable Minister, and we have talked about it. But I'm also happy that in the recent survey, the spread has gone slightly down, and we are praying that it goes down and down and down. And we are not going to rely 100% on this vaccine, but we shall continue spreading the message, talking to our people, sensitizing them, and also involving other groups that are so vulnerable that need to be talked to so that they help us and we join hands in this. I want to thank you once again, Honorable Minister. And as I finally go back to sit down, I also want to inform you, the Minister will do it better. I want to inform you that we'll be hosting His Excellency the President here because of the hard work the Honorable Minister did in this region. Tomorrow we'll have the President here to say thank you to this region, and we owe it a lot to the Honorable Minister of Health, who has been on the forefront in ensuring that our people move in a positive direction, a direction of healing, a direction of hope, and a direction of development. And we thank you, Honorable Minister, and also for the trust the people of this region still endowed upon you and retained you as the Member of Parliament. This follows tremendous achievements you have attained in the areas of health and also mobilizing our people towards wealth creation. You have done tremendously well, and as a result, the President is coming to say thank you to you and to the people of the region, and I congratulate you. I thank you very much, and I say this for God and my country.
Let's appreciate the RCC, a round of applause. Thank you very much. Ladies and gentlemen, we are carrying on with our program. Allow me to invite my co-MC to invite a group that will give us a brief interlude in 3 minutes. Thank you.
Okay, thank you so much. Torabolo be the performing yoko. At least where ti Premier Kadaki Hadek. So binigal wangwa no wati koro loko kene amea waranyim. Some technician, be standby.
Thank you. As they come, I would like to once again emphasize this is not a vaccine. It is a prevention drug, pre-exposure prophylaxis drug that is a bit long term, 6 months. So let's not consistently call it a vaccine. The vaccine is still under development, but hopefully there will also be good news as far as the vaccine development is concerned. So let's not call it a vaccine. Thank you.
DJ?
Chatando pure neno chan. Chatando pure neno chan. Now, my senior, let's proceed.
Thank you very much for that brief interlude. Allow me to invite the chair of the AIDS Development Partners to make their remarks. The representative of AIDS Development Partners, you are welcome.
Honorable Minister, I'll start by introducing myself. My name is Joy Batusa. I work as the country director for the Clinton Health Access Initiative in Uganda. I stand here with partners as their current chair. Honorable Minister of Health, the Deputy Chief of Mission, the Minister of Health, the Deputy Chief of Mission, the Minister of Health, the Deputy Chief of Mission, the Minister of Health, the Deputy Chief of Mission, the Minister of Health, the Deputy Chief of Mission, the Minister of Health, the Deputy Chief of Mission, the Minister of Health, the Deputy Chief of Mission, the Minister of Health, the Deputy Chief of Mission, the Minister of Health, the Deputy Chief of Mission, the Minister of Health, the Deputy Chief of Mission, the Minister of Health, the Deputy Chief of Mission, the Minister of Health, the Deputy Chief of Mission, the Minister of Health, the Deputy Chief of Mission, the Minister of Health, the Deputy Chief of Mission, the Minister of Health, the Deputy Chief of Mission, the Minister of Health, the Deputy Chief of Mission, the Minister of Health, the Deputy Chief of Mission, the Minister of Health, the senior leadership from the Ministry of Health, distinguished development partners, local government leaders, regional health leadership, healthcare workers, community champions, ladies and gentlemen. It is an honor to stand before you as chair of the AIDS Development Partners to mark what I truly believe is a historic moment in Uganda's HIV response. Through the HIV combination prevention strategy, and we had Dr. Mutumba describe that this morning, Uganda has systematically tackled the structural, the behavioral, and biomedical drivers of new infections. The results have been truly remarkable. We've all watched how new infections have gone down, how deaths have gone down, yet the path to epidemic control by 2030 demands that we must do more. We must move faster and we must reach further. So we believe that LENACAPAVIR or PrEP is answering that call to move faster, to do more and reach further. However, we also believe that LENACAPAVIR is not simply a new product. Ladies and gentlemen, it is a new chapter. This twice yearly injectable removes one of the persistent barriers that we know are stopping us to go further. The barrier around daily adherence. For those of you that may be aware, we know that there are barriers around daily oral prevention or daily prevention. So this innovation, LENACAPAVIR, offers protection that comes with dignity and discretion. So as the AIDS Development Partners Group, as you all know, we have worked alongside the Ministry of Health to support the evidence. We have supported not only the evidence, but also the supply chain, the health systems preparation, and everything that has brought us to this point. I want to say, Honorable Minister, that the AIDS Development Partners remain committed to ensuring that phase 1 sites are equipped, that health workers are prepared, and that communities can access this tool safely and equitably. Therefore, as chair of the AIDS Development Partners, Honorable Minister, I speak for a community of organizations that are united by one purpose, and that purpose is to end AIDS as a public health threat in Uganda. We stand firmly behind the Ministry of Health leadership. We pledge our collective technical, financial, and advocacy support, as always. And as always, I call on every partner here today to align behind the ministry's guidance. We must avoid fragmentation, and we must invest in a coordinated implementation. Our clients deserve a seamless experience. And to all of us here today, let me remind you, or remind all of us, that a launch is only as strong as the system behind it. So let today be more than a ceremony. This should be a genuine catalyst for equitable, safe, and rapid uptake of LENACAPAVIR and other prevention methods across Uganda. Honorable Minister, I want to close with gratitude. To you, Honorable Minister, and the Ministry of Health, thank you very much for your visionary leadership and for bringing this launch to LERA. Bringing the launch to LERA signals right from the onset that this rollout belongs to all of Uganda. To our health workers, you will deliver this intervention at the front lines. You are our true architects of epidemic control. To the communities here today and beyond, You have long advocated for prevention choices. Your voices have brought us here today. Thank you very much.
Thank you so much, Madam Joy, for those beautiful words. Let's
Can we
proceed.
clap like we mean it?
For your batek.
Thank you very much. Allow me to recognize Mrs. Lillian Moleko, the Global Community Advisory Board member. Recognize our Commissioner Community Health, Dr. George Opentho Dugum. You're welcome.
Thank you so much. Now let's proceed. Let me now take this opportunity to invite a representative from Global Fund to say something. Thank you so much, and you're most welcome.
May I request that the CCM board members who are present, those who can make it to the podium, to come here. In the meantime, dear Honorable Minister for Health, Dr. General Machero, all Minister of Health and Government dignitaries, His Excellency, the U.S. Government Ambassador to Uganda, represented, the Deputy Head of Mission, and all USG dignitaries, dear local government representatives, including the dear chairperson lady, who introduced herself in the morning, development partners, dear guests, ladies and gentlemen. My name is Dawson Kalemba, and I work with PwC, PricewaterhouseCoopers. I represent Global Fund as local fund agent. Global Fund doesn't have a presence in the country, but at country level we have a country coordinating mechanism, which is Uganda Country Coordinating Mechanism. It works as the board charged with oversight and fundraising. Please allow me to hand over the microphone to them, and I'll come back and give Global Fund his statement. Thank you.
Thank you very much. Honorable Minister, my name is and I sit on the Global Fund Board and the Vice Chair of the Program Oversight Committee. I was requested and delegated by Honorable Meda Dibitecherezo, the board chairperson of the Uganda Country Coordinating Mechanism for Global Fund, to represent him. He would have loved to be here, but unfortunately fell unwell, and requested specifically to inform you of that position, but he would have loved to be here. In front of us are board members of the Uganda Country Coordinating Mechanism, and allow me to, in a minute, request each to introduce themselves and also tell us the constituency they come from. Thank you.
Hello, thank you. I'm Kim Gustafsson from UNH.
Good morning. I'm Mary Borkman from the U.S. government. I'm Ruth Akulu. I represent the youth.
Good morning. I'm Immaculate Omcha. I represent people living with HIV.
My name is Joy Batusa, Country Director for Clinton Health Access Initiative. On the CCM board, I represent the international NGOs.
Good morning all. Luimba's Tony Steve. I'm not a board member and I don't represent any constituency, but I coordinate the operations of the CCM board in Uganda.
Good morning, Jacqueline Katesi from TASO. the second principal recipient for the global funding in Uganda.
Good morning, Dr. Tukoit Bernard Michael, Executive Director at TASO, ex-officio member of the board of the CCM, and a second principal recipient of the global fund. Thank you.
Thank you very much, Honorable Minister. Now, allow me to go to the official statement that deliver on behalf of the chairperson. Honorable Minister of Health, Deputy Head of Mission, U.S. Government, distinguished officials from Ministry of Health, development partners, technical partners, city leadership, and representatives from the government, ministries, departments, and agencies, cultural and religious leaders, members of the media, civil society representatives, ladies and gentlemen. Good morning to you all. It is my honor and privilege to join you today at this very important occasion, marking the launch of the long-acting HIV prevention tool we are calling LEN here in Lira City. And I bring you very warm greetings from Uganda Country Coordinating Mechanism for Global Fund. Allow me to express my sincere appreciation to the government of Uganda through the Ministry of Health for convening this very important event and for your continued leadership in the fight against HIV. I extend our deep gratitude to Global Fund, who have made a contribution of $1.2 million for this innovative but costly prevention tool such as LEN to become accessible to the vulnerable and priority populations who would otherwise not have afforded it. This is a significant step forward in our collective effort to reduce new HIV infections. Ladies and gentlemen, while we celebrate this milestone, it is important to emphasize that the introduction of LEN does not mark the end of HIV. However, it represents an important addition to the existing HIV prevention toolkit we already have. We must therefore continue to promote and invest in comprehensive combination prevention approach. Of course, we have other proven and effective tools, such as the condom, that must remain at the center of our prevention efforts. For decades, condoms have demonstrated their effectiveness, accessibility, and affordability, and that they continue to save lives every day. As we embrace this innovation, let us not lose sight for this foundational intervention. Honorable Minister, the launch also presents an opportunity to call upon government of Uganda to continue strengthening domestic investment in health and particularly adopting and scaling up new technologies and innovations such as LEN. Sustained financing would be critical at this stage to ensure that these long-saving interventions are not only introduced but are equitably accessed and sustainably delivered across the country. From the perspective of CCM and the Global Fund, we remain committed to supporting Uganda to strengthen integrated service delivery across HIV, TB, and malaria, and within the broader health systems. We want to ensure that interventions deliver maximum impact and value for money, and also prioritize the need of the vulnerable and the underserved populations. And lastly, we want to promote sustainability through increased domestic financing and stronger healthcare systems. So as we move into Global Fund Grant Cycle 8, these principles must continue to guide our collective efforts. Ladies and gentlemen, Allow me conclude by reaffirming the commitment of Global Fund and CCM to provide effective oversight, promote inclusive dialogue, and ensure that Global Fund investments continue to deliver impact for the people of Uganda. Also, I would like to thank the US government and other development partners for their contribution towards this HIV prevention tool that we are launching today. Together, through strong partnerships, innovation, and sustained commitment, we can accelerate the progress towards ending HIV as a public health threat by 2030. I thank you for your kind attention. For God and my country, Dr. Medad K. Bitecherezo, Board Chairman, Uganda Country Coordinating Mechanism for Global Fund. Thank you very much.
Right, Babu Nichiwa for Global Fund, P. Kwena Ameginomio. Thank you so much, and you can step down. Now, Jametia Riwapi Gitego, Namachiel. Oh, sorry, you're still continuing, sorry. But let me just pass this message. Joametia Meto Kwanyuremo, Tuncha, Jotia me Ureme ye, Wurure me Uremo me Kwanya Joakongi late. You can proceed, sir.
Thank you, Master of Ceremonies. I beg your indulgence. So this was the country coordinating mechanism. With me, I have a statement from the Global Fund Secretariat, from Lyndon Morrison, the head of High Impact Africa 2, Uganda inclusive. All protocols observed. On behalf of the Global Fund to fight AIDS, tuberculosis, and malaria, I would like to warmly congratulate the government of Uganda, the Ministry of Health, civil society organizations, community leaders, and all partners on the national launch of LENACAPAVIR for HIV prevention. This important milestone reflects Uganda's continued leadership and commitment in the national and global fight against AIDS. It marks a significant step forward in expanding HIV prevention and strengthening the country's comprehensive, people-centered response to the epidemic. LENACAPAVIR, as a long-acting HIV prevention option, has the potential to be transformative, particularly for individuals and communities who face persistent barriers to accessing or adhering to DAIL or PrEP. Expanding prevention is critical in a setting like Uganda, where key and vulnerable populations, adolescent girls and young women, and mobile and underserved communities continue to experience heightened vulnerability to HIV. Today's launch underscores Uganda's commitment to innovation and public health impact. We know that HIV prevention is most effective when it is people-centered. Long-acting prevention tools such as LENACAPAVIR have the potential to support improved adherence, reduce stigma, and enable individuals to take control of their health with dignity and confidence. The Global Fund is pleased to support Uganda in advancing a differentiated and integrated HIV prevention approach, one that builds on strong national systems, meaningful community engagement, and evidence-based programming. We particularly recognize Uganda's leadership, Honorable Minister, in prioritizing combination prevention and in working closely with communities to reach those most affected by HIV. As LENACAPAVIR is introduced in Uganda, we emphasize the importance of the following items: people-centered access, with a focus on populations at highest risk of HIV. Strong community engagement and demand generation to ensure acceptance and trust. Phased and responsible implementation aligned with the national guidelines, regulatory pathways, and health system readiness, and sustained investment in combination prevention, recognizing that no single intervention alone can end HIV. This launch also highlights the strength of national and global partnerships. Uganda's progress against HIV has been driven by collaboration between government, communities, implementing partners, donors, and the private sector. The Global Fund remains fully committed to working alongside Uganda to ensure that innovations such as LENACAPAVIR translate into real measurable impact. We would like to use the opportunity to thank the United States government for the joint work with the Global Fund on LENACAPAVIR and for the tremendous support to the Global Fund. We also thank all other partners present for our partnership and critical support to Uganda's public health priorities, including introduction of LENACAPAVIR. While today is a moment to celebrate progress, it is also a call to action. Achieving and sustaining epidemic control will require continued political commitment, sustainable financing, and relentless focus on reaching those who need it most. From Lyndon Morrison of the Global Fund. Thank you.
Thank you so much. You're done? Please, you can now walk down. Weka ti kedaki hane me nyutu jo otuno lelet yakina wate Karachiel kede City Health Officer Mr. Bernard Nyocheri, Dr. Bernard Otushu boy binone attacked twal Dr. Bernard nena buoko pe yod komilira City can. Then also ti Karachiel kede dana buoko pe yod komilira district Dr. yes aneni here Good Buchan Ochen Obero DHO Melera District. Poyubino Dr. Buchan. Now Obero kede Italuda Chel Mana Adiro Bere Niene Rero Jericho. Kangyoka Jericho Jareta Buru. Bere. Aya do kode Red Jericho wano win. Pakuro Babji Poyoba Nyalo no bere Jimmy Ay nyaput power banyu di jodakna Pala jode ko ni Daka di nyomo dako mer yo ya bete Ada ku jodara di daka ciel gitu Nakai grup jode baru penya Daka ada dikeren ke anak dia Pece dako moro oke ne anak dia nyom mapate man Wege muruga kuduga nye anak dia wergo
Kahong murwa babe ma chela me to koyo ba benina tinene me chako wakara chiel ko ni ayute ya bero Nancy ubere jini ba me ko mi ugu
Nancy Tekanu ni bero amina obera nyomi jani ana bera ta hermo umula obera do microphone bon Nancy ko ngi ta hermer teka mina ni nyomi jani Nancy ta herni kono
abere nyanga mo umula
obera mi achin pe labo
Ninde piero wabi
okay
Nonyi watu ke modogolo
Aya do Wati mi be
Imat bol na ada no tunu ko borri Naya bol ni dam ti borra da mi yu ko jaani ni awe
Chata
No, Obara. You are the kind of do better, Jalare, Mayor, the minister. Children know you know me, I come in your man, I yet I have a mayor.
That song everywhere, and it's a very powerful song. So thank you.
Director of this function. Professor Charles Solalo, the DG, has sent his apologies. He's attending equally another important function in Munyonyo, and is representing the Minister of Health, who have been with him in this sub-region since Wednesday. Definitely he had planned to be here with us, but we are glad that the Minister is here, and there are quite a number of commissioners from Ministry of Health who are supporting the technical team. Hello, Minister, I'll be very brief. We do not have to dilute your remarks. Most of the speakers that have made remarks here before have talked about a number of things regarding LENA, but of course also the HIV prevention agenda. I'll just make one or two comments. One, we appreciate all the innovations that are geared towards preventing HIV among our young people. But of course also, Honourable Minister, allow me to stress that most of these biomedical innovations that are geared towards preventing HIV have equally led to the decrease in risk perception in communities. To the young people, they don't take HIV as a very serious disease these days. Is really worrying. So I know we have many development partners here and many implementing partners and many healthcare professionals. It is our responsibility to ensure that the HIV prevention agenda focuses both on the biomedical approaches, but of course also the behavioral approaches. We shall rely heavily on our non-health actors at community level to engage responsibly with the guidance from us as the sector, as we strive to ensure that our individuals, our communities, people in communities do not get HIV. One last key message to our service providers: for the facilities that have already been designated to provide LENA, we call upon you to do detailed assessment of all individuals who will be visiting your facilities to ensure that they are actually eligible. Currently, we still have few doses in the country, and we know that the demand for LENA is high because of the exciting good news that comes with. So kindly do detailed assessment and ensure that only those who are eligible for now receive LENA. Number two, as the program manager for SCP indicated, we request you to do extensive health education to all those who will be visiting to ensure that they don't forget other preventive measures for HIV. Lastly, on behalf of the DG, we do thank the research team, the Ugandan colleagues that participated in the research, but of course also the partners that we have worked with as the sector in this HIV prevention journey. For the technical teams at the Ministry of Health, we do appreciate you, especially the SCP program, in driving the implementation of the HIV prevention programs in the country. With that, Honourable Minister, allow me to invite the Deputy Chief of Mission to come and speak to us. Thank you.
Apoyo Matek.
On behalf of the U.S. Embassy and the teams that we have there that are working on health, on behalf of Ambassador Pop, on behalf of the U.S. people, I'm very pleased to be able to deliver some remarks to you today on this very important occasion. Yesterday we had also an exciting event, and it was provision of some equipment to the community health extension workers. And the energy there was also palpable, and I want to thank you for all those who are working in public health, doing exciting things in this area. We're so glad to be partnering with you. So good morning, Honorable Minister of Health and other government officials, and resting on all the other protocols that have been already laid out, distinguished guests, friends, and partners. Today we launch LENACAPAVIR in Uganda. It's a groundbreaking HIV prevention tool developed with American innovation and private sector partnership that will save lives and bring us closer to ending HIV as a public health threat. The America First Global Health Strategy that the State Department released last September transformed the way that we do health work globally into an effort that is very directed at building resilient health systems and also to strengthens like the one that we are recognizing here today. In the spirit of that, on April 14th, just a few days ago, the United States announced with the Global Fund and Gilead that it is committed to reaching 3 million people in high-burden countries with lenacapavir by 2028. With the ability to avert nearly 100% new HIV infections, lenacapavir has the potential to save many lives. That's why this matters. Following that April 14th announcement, the United States and Global Fund are collaborating and working closely now on buying and distributing doses to put those 3 million people on lenacapavir worldwide, with a focus on reducing mother-to-child transmission. This life-saving, innovative investment will be a game changer in the fight against HIV, and it will catalyze further global investment. So what does that mean here in Uganda? It's a critical breakthrough here. Nearly 37,000 people are still infected with HIV here every year, and over 11,000 among adolescent girls and young women aged 15 to 24, and close to 5,000 among children under 14 years. 37% of new pediatric HIV infections are linked to mothers who acquire HIV during pregnancy or breastfeeding. So this is why our strategy matters, to target those groups and help those individuals, and why the U.S. strategy prioritizes self-reliance, national leadership, innovative solutions, and durable systems that protect both Americans and Ugandans. Lenacapavir represents this approach in practice, not just on paper. Since 2003, through PEPFAR, the United States has invested more than $260 million in Uganda's national program to eliminate mother-to-child transmission of HIV, and more than $100 million to expand access to pre-exposure prophylaxis, or PrEP. We've supported PrEP at scale, and it's worked. In 2017, PrEP was available in only 7 health facilities in Uganda, and today, nearly 700 health facilities provide PrEP services, and more than 900,000 individuals at risk have received it. Between 2015 and 2025, mother-to-child transmission rates fell by more than 70%. And now, with lenacapavir, we are taking this progress to the next level. And this is what American investment in innovation and Ugandan leadership and partnership deliver measurable, life-saving results. The United States government and Global Fund, in collaboration with the Ministry of Health, is providing doses to put approximately 46,000 people on lenacapavir here in Uganda in 2026, with additional doses available next year and beyond as supply chain conditions improve globally. Uganda's selection as a launch country is no accident, no coincidence. It reflects strong national leadership here. It reflects robust service delivery systems, thanks to the Ministry of Health and partners, and it reflects the proven results that we've already seen. Uganda's commitment to adopting next generation HIV prevention tools demonstrates determination to remain at the forefront of the fight against HIV. LENACAPAVIR gives individuals at risk, including pregnant and breastfeeding women, more control, more protection, and more power to safeguard their health and that of their children. This directly advances our shared strategic goals of reducing new HIV infections and ending vertical transmission by 2030 in high-burden countries. This is how we move closer to a future where no child is born with HIV. We recognize the work ahead, sustaining prevention coverage, ensuring adherence, reaching vulnerable populations, and strengthening health systems. We support the vision that every Ugandan at risk should have access to effective HIV prevention tools, that every child should be born free of HIV, and that every community should have the tools it needs to thrive. To get there, each of us has a role to play. District and facility leaders must safely manage stock and ensure LENACAPAVIR and other HIV prevention tools are available where they're needed most. Health workers must continue to counsel clients, create demand, and build trust. And citizen and community leaders must share the information you have heard today with family, friends, and neighbors who can benefit from this remarkable advancement. So we stand shoulder to shoulder with Uganda in this mission. Today it's about American innovation, it's about Ugandan leadership, and it's about shared results, but most importantly it's about you. We honor the health workers who deliver these services, and we reaffirm the enduring friendship between the United States and Uganda. Together we will end HIV. So thank you, Apoyo Matek.
Good. Lao kada niao yot. Ngatoro ko bilao ne kai mi tu winyu lemo. Berding mod iwinyu duchi yot. And then we would ling mod telekin in yang una pelara. Babji po yekeri. Now, we are proceeding, but let me recognize the following. One, the mayor of this great city, Mayor Lera City Samatul, Honorable, His Worship, you're most welcome. Bishop Tom Ibrahim, thank you so much for coming. Bishop May All Nations, Poymatek, Ekadang Otikara Chelkede, Bishop May Truth Fountain, Poymatek, good, Wanalueni Ukalo Ikwang, Tuanange Jiro Pemetu Hutuhu, is a very senior person in preaching the gospel. You're most welcome, James Bishop. Now, we're inviting the minister, my senior Emma. We are supposed to invite the minister, but before that, Sister Nancy, Jinene John, the minister, kede where kede kaka awa gel. So it's, I think, it's a combination. Good. Uni where Major Law Minister, then Minister Dong Tibino Mekobo Kop Papira Tech. Kita don luang menying jatuh na awo kita yelo jome mengerano. Okay.
Okay. Thank you so much. Jodisha Matika Tinini. Wanapoa the program metia ti American da poi mat. Wanajole matke wera chela mekoni. Achengo chero yipi do parliament. Are you ready? Achengo chero yipi do parliament. Parliament. Achengo chero yipi do parliament. Achengo chero yipi do parliament.
Luka.
Sister Nancy Keruhuru Kene, Babulachiwa Majolo Minister, Amedo Binulo Karachi and Kerewa. Babulachiwa Yuru Yomgate. Oyimatek, the Mat Minister don't Binulok, Kobudo Pere Duch, Nahanying Yata Woki Lungote Yelowani Woneroen, and Lunga Bear, Lawan Duch.
Your Excellency, the Deputy Chief of Mission, the U.S. Embassy, development partners in your various capacities, and implementing partners, the senior consultant, Lira Regional Referral Hospital, the Director General, Health Services, represented by the Commissioner, Health Promotion and Education, the clergy, the bishops present, representatives from Global Fund and the CCM, our dedicated health workers, distinguished guests, and my dear people of Lira City and beyond. Good afternoon to you all. I have a challenge here. People want me to use the local language, but I also need to use English. So for purposes of the launch, I will first speak in English, and then I will translate to the local language. Luat Lira City Tiaunu, Obanguahu, Ijol Unuwele,
Yiwu yomi yatanyen na meokelo. Imaru unu yat. Apoyo unu matek. Wekwa chaki keli uamota duomu lova kino. Uyai both President na Uganda, Yoweri Kaguta Museveni, ameniko kome dihi abeduke dwakan. Doami tuninge chu romi ping duj wan dushu dihi yoti a cheleken kwene Ilao College. Yoti kwene matimuru tikunu romo. Yo winyumo dan jope wi wupe will yo dusha wori Ilao College. Wedo adwa hoko ileb mono. It is with great pride that I welcome you all to this beautiful city of Lira, to the launch of a new innovation in our fight against HIV/AIDS, the LENACAPAVIR. And I am sure that my people of Lira can say LENACAPAVIR. Kongjoko meawi. Kado lawa uteko boni Lena. Today is a very special day for Uganda, and especially for the people of Lira City and the entire Lango sub-region. And I stand here not only as the Minister for Health, but most importantly as your daughter and your representative in Parliament. It gives me great pride that Lira City was chosen as the first place in Uganda to launch the groundbreaking HIV prevention medicine, LENACAPAVIR. This milestone has not come by accident. It is a result of the strong leadership and commitment of the government of Uganda under the National Resistance Movement led by His Excellency Yoweri Kaguta Museveni. From as early as the late 1980s and 1990s, when HIV/AIDS was devastating our country, Uganda stood out as a global leader in confronting the epidemic with openness, courage, and decisive action. That same commitment continues to guide us today as we move towards ending AIDS as a public threat by 2030. As a country, we have made significant progress. We have reduced new HIV infections from 96,000 in 2010 to 37,000 by the end of 2025. Expanded access to treatment to over 98%. We have 1.4 million Ugandans on treatment, and strengthened our health systems across the country. However, we must be honest with ourselves. HIV is still with us. About 100 new individuals acquire HIV every day, of whom 33 are young people, majorly adolescent girls and young women. We must close the tap on new infections. We therefore cannot afford to slow down in this fight. That is why today's launch of LENACAPAVIR is so important. It is not just another medicine, it is a game changer in HIV prevention. It is a long-acting injection, as you have heard, given only twice a year, making it easier for people to protect themselves from HIV infection without the burden of taking daily oral pills. It is highly effective and offers new hope, especially for individuals who are at highest risk of acquiring HIV infection. Ladies and gentlemen, as we embrace these new innovations, we must not forget the basics. Prevention remains our strongest weapon under the combination HIV prevention strategy. Therefore, I want to strongly remind you of the ABC approach that has guided us for many years. For our young people, abstain until you're ready for marriage. For those who are married, remain faithful to one partner. And for those who are sexually active and have more than one partner, please use a condom and use it correctly and consistently to avoid the spread of HIV and other sexually transmitted diseases. At the same time, I want to strongly encourage all of you here to test and know your HIV status. It is our first step towards ending AIDS by 2030. Testing is free, confidential, because we also have self-test, and it is available in all our health facilities, including the pharmacies. As the ministry, we know that there are still many people, over 150,000, living with HIV who do not know their status. These individuals continue to spread HIV unknowingly. But once you know your status, you can start treatment early. And if you adhere to treatment, your viral load will be suppressed. You will live long, and you will live a productive life and protect others. To the people of Lira City, I want to say this very clearly. This opportunity begins with you. You are the first community in Uganda to receive this prevention intervention. Let us embrace it. Let us lead by example. Let us show the rest of the country that Lango is ready to take charge of its health and its future. There have been many questions. Why are we not giving the medicine to the people who are already HIV infected, so that we can also reduce the pill burden amongst them? I am extremely happy that the researchers are here, and therefore I would like to invite the Executive Director of JCRC and the researchers. Please come and talk to the people of Lira and explain to them why this medicine is for prevention and not for treatment, and when we shall launch the one for treatment. So coming up is the Executive Director of JCRC, Dr. Sise Chitio, she will speak, I will translate, don't worry.
Thank you very much, Honorable,
Apoyo Matek,
for putting me on spot and others. From the previous speeches you have heard, the speakers thank very much the teams of researchers that have worked on this LENACAPAVIR for prevention, and that is how we got here, through research and evidence. The issues of adhering to antiretroviral drugs for those that have HIV is big. And so we've also been working as researchers to see how we can get these injectable drugs for people who are taking oral antiretroviral drugs every day.
wana chalo jwa metimo research nyokeboro yen na nyen utiu yella tek to twal meneno ni unuo holoto yat me konyo kor jwa me monyo yat neno.
Last year, we led a study using injectable antiretroviral drugs across Africa.
Imwaho karone wano chaho research nyokeboro yat ame utushu kere jo atusha i Africa tushu.
Those results have led to WHO revising the guidelines and putting these drugs into the guidelines.
Gina me wano nuo ena yomi WHO nyodula duonga me loko pikom yotkom meketo yatiene iye book meme yojo chako nuongo.
You've also heard today they are saying we only have a few doses of Lena.
Tina iwi unu kowone en yatiene na metin wano tiu launching yene welera me okelo nyo welera me otia yobo kodno noha.
Because it is still very expensive. So the innovators of these drugs have identified generic manufacturers so that they can produce these drugs at a much lower cost, and more of these for prevention can be available.
So geometry yobo utiute mitek gidushu me yenyu joametwero yobi wela ping me wek yatiene beda duonga me romo jodushu.
For HIV treatment, we don't use just one drug. What we have evaluated in the trials is a combination of two drugs.
Joame tuo jonyo yara chelle ken petiu yata jo tuo jonyo beru yena dek. So enna meginu tiu keberocha tie ye yena dek yachiel.
These two drugs are also in the process of being manufactured by generic manufacturers.
Tia yena rio. So tiu ye legini dang meneno ni jo ame yobo uchako yobo.
So this is collective effort. Moving forward, how do we get these drugs for treatment for patients who are on antiretroviral drugs? And one pillar, we've done the research. We have the results. WHO has put this in guidelines. But like what we are doing today with the drugs we are using for HIV, they are produced by generic manufacturers at a low price. That is why everybody now is able to access these drugs. So after the research, the generic drugs will be out, I think next year, maybe in the second quarter, for HIV treatment. Yeah.
So eno kobo ni mea joame tuo jonyo keburuda do tumuko joame yobo tia tutatek meneno ni uyobo gini nyo manufacturing gino ko ento amito joame yubi wela yot mewek do imwaka binuni uteda ndonketi book mewek jo cha teach kere.
So jointly, I call upon the patients who are on antiretroviral drugs, the civil society organizations, to put the pressure.
So endong tia actually duane boru tu kere jo me civil society ni ke rulu pressure tek ni yato jo amito.
I ask my honorable minister and her team, the guidelines are there. Let us work together again and put pressure to make sure that we have the generic drugs available for our patients.
Eno ko uniti do tumuko pressure ena mite me yatuka tuo ho pijo ametuo tuo jonyo.
The development partners are here, so I am very happy. We have Global Fund.
Global Fund eno ko biuno.
We have PrEP Fund.
PrEP Fund and PETIE to the Department of State.
We have government officials.
Gamente dang tiuchu ilangere.
This is joint effort.
Mano vero tich wadushu.
Effort between the government, the ministry, the development partners, the patients, the community, and us, the researchers. And we are also now in development of new research that looks at drugs that can be given maybe every 6 months or even every year, because those drugs are there. But we need to evaluate them in our populations.
So, keboriya dangkutia mede, tiyen na me otwero me yunge dwera bishel nyo yunge mwaka chiel.
That's all I had to communicate, Honorable.
Kopere do tumu kwa poyo mate. So uni dog jo ametimo research, atamo ni pe kwani wako na uni yiru. Atemo dangiteka duj megonyi lebla. To our health workers, allow me to thank you for your dedication. And in a special way to appreciate Lira Regional Referral that has kickstart the giving out of LENACAPAVIR. I ask you commitment to ending AIDS as a public health threat by 2030. We shall continue investing in prevention, treatment, and strengthening health systems so that every Ugandan can access health services. Allow me now to express our sincere appreciation to all our development partners who have stood with Uganda in this fight. In a special way, allow me to recognize the government of the United States. Your Excellency, we want to thank you first for your presence here at this launch and for the long-term partnership that we have had. We appreciate the recently signed government-to-government memorandum of understanding, that is the famous MOU, and the commitment to support access to new HIV prevention technologies, including LENACAPAVIR. Kai poyo unu kareme campaign anabina kobi wunia wori US uye gini miyo wachente usigning dandoko en MOU ameatia poyo ge ye no ametino keli wayate amedang doha keli waeno ken na me okobucha. I want to acknowledge the Global Fund for your continued investment in Uganda's HIV, TB, and malaria response, including health system strengthening and support towards the procurement and introduction of the initial doses of LENACAPAVIR that we are launching today, in addition to other essential commodities. I wish to thank the UN family, including the World Health Organization, UNAIDS, UNICEF, UNFPA, bilateral and multilateral agencies for your unwavering support. I also thank the Uganda AIDS Commission for the multi-sectoral coordination of HIV response. All government ministries, departments, and agencies, political, cultural, and religious leaders, and other key stakeholders for all the efforts you have put in the fight against HIV. Last but not least, I extend my appreciation to the implementing partners, civil society organizations, research institutions for your dedication, support, and close working relationship with our communities to deliver integrated services and the generation of evidence that guides our programs. Allow me to thank again Lira Regional Referral Hospital and Lira District for hosting this event. The Ministry of Health AIDS Control Program for the work that you have been doing over the years, together with the supporting partners, Baylor Uganda, JCRC, Muju, and Chai for your support. Let me conclude again by appreciating His Excellency, the President, for his continued leadership and guidance, and the people of Lira City and beyond for your resilience and cooperation. The ministry remains committed to working closely with all of you to ensure that communities access integrated healthcare services, and these include the investments that deliver real impact. Together, we can end AIDS, not through words alone, but through action, unity, and commitment. I thank you all for listening to me, and may God bless you and bless Uganda.
Okay, thank you so much. Sound technician, first put it down.
Before I sit, allow me to request the MC. We have people that you have not recognized.
Yes.
Maybe you would like to take that opportunity to recognize their presence.
Okay. Yes, that is good. Icha me mat minister. Ko ba fuchi wa po minister tech. Icha entia log. One obero karachiel kede. Yes, obero karachiel kede tuno a bishop me diocese of Lango. Ngeu ni nyebo? Okay. One of you obero karachiel kede tuno bishop me diocese me Lao, Right Reverend Professor Alfred Olua. Po yibina pap. Icha jinwo ki pesha. Jopo wakan won't better do pay. This is just for the bishop. Jopo wakan chaji ni pe jo me jotko. Ni me achiel man pe obeda kwera. Obedo yat me otushu kede dano ko batuo jo. Dango tushu mo achiel lingo irio. Dango tiko biwani wano ko bijo ne ka otushi pede wore dang ni wa mahere kedi. Pien po mi remade kwa yo kwango aber so ka cheng chabi romo ananga yuni church beauty kele forum yo about twal. Now let me take this opportunity.
Thank you very much, Honorable Minister. Supposed to happen right here, so I kindly invite you with the previous speakers to do the physical launch, but I wish to recognize once again Honorable Lieutenant Colonel Evelyn Asimwe, Director of HIV/AIDS in the Uganda People's Defense Forces, representing the Joint Staff Health Services. Once again, you're welcome. Let's have the demo because on TV, live TV, we have few minutes and we want the launch not to be missed on the live broadcast.
Okay, Honorable Minister is ready, and I think the entire team will join her in the launch. So, after this launch, she'll be in position to hand over some certificates of appreciation to the organizing team, organizing committee. So, Honorable Minister and the entire team.
The DG representative.
Sound technician, please wait.
AIDS development partners, the Deputy Chief of Mission.
She's inviting the clergies who are there to join.
The clergy, the principal investigator for LEN. We are going to witness the official launch of this drug, not a vaccine, that will be administered every after 6 months or twice a year. So let's give the microphone to the Honorable Minister to officiate this symbolic launch, explain why we didn't have the actual beneficiaries, because people would be wondering, why are we not injecting directly into the fresh? Why are we using a dummy to demonstrate the launch? So Honorable Minister, you might need to explain why we are not having actual beneficiaries getting this injection straight to the body. The nurses, you can stand on the podium for visibility, and we welcome you, our health workers.
Okay. So, as the act of the launch, we are going to inject the abdomen, and unfortunately the abdomen is smaller than the injection. But then Len is given either in the abdomen or in the thigh, and it is given as a subcutaneous injection. So we are just going to inject this into the abdomen to just show as a way of launching the injection. Yes, you're welcome.
Ni yatiene utushu itedelkom utushi yi ni utushi ya muni etu miruberi itedelkom Joriano. So now I can declare LENACAPAVIR officially launched for God and my country.
Okay, Obamuni Wabe, Opua Minister, Kedenti Meret, man launching the Tirati, Yati, Metakodo teach Uganda can. Okay, Oberukede Mayo certificates, Minister Bino Timo, and to Kawati Ekoro Manono. Group to Motalong, the 4C Ubuntu. Please, Binuno Khan.
All the guidelines for the use of LEN. Honorable Minister, allow me invite you to ensure that you launch the guidelines on how we are going to use this LENACAPAVIR. The one responsible for the launch of the guidelines, we need a pair of scissors. Pair of scissors, Tim. Oh, we are going to use the marker. Okay. Thank you.
immediately after that, we shall have a group photo. Immediately after that, we shall have a group photo. Okay, immediately after that, we shall have a group photo. Okay, so Honorable Minister and the team, let's have a group photo just right where the launch was taking place. Let's have a group photo so we can clear that table for us to have a group photo. Okay, let's just clear the table and then we have a group photo. Honorable Minister and the team, all those who are at the launch, please, let's organize and have a group photo. Director, Regional Referral Hospital, please take charge. Let's organize for a group photo, and then we come to the climax. Yes, let's have a group photo. Immediately after the group photo, we shall sit a bit and have one entertainment. Then the minister will again step up here to issue certificates of appreciation to the organizing committee. So immediately after this, we shall sit a bit and have one more entertainment. Then the minister will step up here to issue out the certificates. So the cameramen, are we done? We almost? Okay, 30 more seconds. I think this is good enough. Thank you so much. Okay, Honorable Minister and the entire team, please, you can take your seats. And Fosi Ubuntu, please, it's your time. Fosi Ubuntu, you will entertain us for a maximum of 3 minutes. Then after that, we shall invite the minister back again to issue out certificates. Then we call it a day. Okay, sound technician, we are good to go. NBC record. Last one, just that one now, and we conclude in 1 minute. Play it.
Tumetoka mbali, hapo tunaenda mbali. Tumetoka mbali, hapo tunaenda mbali. Tumetoka mbali, hapo tunaenda mbali. Mbali. We came from far, we still going far. We came from far, we still going far. We came from far, we still going far. Life is a journey. Life is a journey. It's a journey. Life is a journey. It's a journey. Life is a journey. It's a journey. Life is a us. Life is a us. Life is a us. Life is a us. Life is a struggle. Life is a struggle.
Amiro miel kera di po unipo pe otusha. Koinu otusha no raiye. Now wega long minister. Maybe no me yo certificates ni por wegi. Era yo nge ya kana utusha ro. Are di moya. Yeah, walk down. Let me now invite Honorable Minister, please. You can walk on the stage again so that we can hand over the certificates to the committee for this launch. You're most welcome.
Coming to the close of this ceremony, allow me invite the following people to receive their certificates as members of the organizing committee. Allow me, and the minister says you should come running or sprinting. Allow me invite Dr. Robert Mutumba, who is the Assistant Commissioner in charge of AIDS control.
Good.
Followed by Dr. Herbert Kadama, who has been instrumental in coordinating the organizing committee. Let's appreciate him. Followed by Ms. Dina Kwarisima, also a member of the organizing committee.
Thank you.
Members should stay for a group photo. Ms. Harriet Nangobi, Fairuz Naiga, Dr. Fairuz Naiga, Dr. Andrew Odur, who is the Senior Executive Consultant, Lira Regional Referral Hospital.
Okay.
Let's stay for a group photo. Mr. Peter Okero, you're welcome. Peter Okero. Kenneth Mweonge, you're welcome, Mr. Kenneth. Dr. Betty Sanji. Mr. Gerald Pande. Ms. Pamela Achi. She welcomed the drug at the airport. Will be followed by Gerald Pande. Miss Pamela Achi, Mr. Tibihenda Haddison Kato will follow. Dr. Daniel Kasozi, Dr. Daniel Diamukama, Dr. Boniface Bongo Yinje, complicated. Miss Victoria Nachiganda, Mr. Emmanuel Semanda, Mr. Dennis Bwanika, Dr. Veni Nabitaka, it is my turn also to receive a certificate, so let me say.
So this is going to Emmanuel Aine Biona. After that, you come back here. This name is very complicated.
Miss Lilian Jereze, Dr. Caroline Akero, Dr. Flavia Matovu Chiwewa, who is the principal investigator with the Muju. Miss Florence Nampala, Dr. Peter Mudiope, Dr. Peter Mudiope, Dr. Caroline Akero, the principal investigator is Flavia, Dr. Flavia. So, yes, as a disclaimer, if you are not rewarded and you are on the committee, we will reward you next time. Hey, Florence Nampala. Florence, don't kill me. So let's have a group photo quickly. Now, let's go down.
Yeah.
Go down. The picture is better in the sun. Yeah. So meanwhile, police band, be ready to give us the anthem in reverse order.
And after the police band taking us through the anthem, we shall, in a special way, invite Bishop Professor Alfred to give us a closing prayer. Cameraman, are we done? Good, thank you so much. Police band, please take it up. After that, closing prayer will be done by Bishop Professor Alfred Olwa. Oh, after this we shall have lunch. That means even the bishop will pray for lunch as well. So police band, please.
Let us pray. Almighty God, we thank you because you're the gift to us, gift of life, gift of work and service, but especially for the gift of this new LENACAPAVIR that has been launched to save lives. Thank you. Now open doors for money to purchase this drug. And for the people have been able to work as partners with us as a nation in this, we thank you. Thank you for Lira Regional Referral. Thank you for our Minister of Health. And we thank you for our country, Uganda, working hard to save lives. Now bless us. Bless the food that we will eat. In Jesus' name I pray.
Thank you everyone for coming. I've been Emmanuel Ainebiona, the Director of Program, together with
Elvis Ajuha Meposh Wukonka to get the voice of now for Womatek. So launched here and there are serving points Amir T Unokere, you are a bear. And I don't T side my VIP ni. If I will Dikini, President Yoweri Kaguta Museveni, Abedo in Lao College, Chona Chawa Ryoke Kenoido Kunono Kunasha. So better tie, Penango Yerongatorjo Dushu, Abeda tie Kunasha, Abo Bar Rumi, Abo Bar Diti, when you Tiunga Queen and you pay to you, President Binu Bedatie. President Binu Bedatie, Eka Utiwinyunda Loka ya Borre. Stopping points put a Mediketo and to VIP tent is ready. Please, members who are in the VIP tent, you can now be served because your food is ready. So, members in the VIP tent, please, you can now be served. So, sound technician, more mumul, na bebe balo mood my gym, ramuwati ituku as we wait. Kanoke na me pope ukero tables here, please. Beduna gonya gina chamatie pengator do chamatikan. So pe ya water me pe chemo. Po matak.
This is like a I can only be available when it's right.